So joint preservation.
So basically, joint preservation is a phrase that talks about trying to preserve the knee. And usually what we're talking about is trying to prevent further arthritis or reverse it if we can.
Yeah, in a way, young people with old knees, not really candidate for knee replacement, but enough pain that something needs to be done.
And sometimes it's just a little defect. So there's just sometimes a little piece of cartilage that's peeling away, and you can do something quite minor like a gel injection, or you can do what's called a chondroplasty, where you arthroscopically go in and you just clean up the little flap, and it can make the knee feel much better. Often it stops the swelling. But that's not enough for everybody.
No, because sometimes the defects are bigger, and then you need to kind of fill them, like you fill a pothole on a road, hopefully just better.
So you can fill them with something that's called cell-based treatment.
So cell-based treatment is we go in, we do an arthroscopy, we take a little piece of cartilage size of a fingernail clipping, and we send that to a lab, and they can grow more cartilage from that.
And that's called MACI, or we can do something called de novo, where there's juvenile cells. So a younger organ donor, when we take their cells and we transplant it into the knee. And in both those cases, we're asking those cartilage cells to grow, which can take a long time. And it works pretty well, but it doesn't give you the cartilage that you started with.
No, it comes fairly close. Nothing is perfect. And that's a little bit more like seeding grass. So truly something grows inside your knee. But then there are other options called osteochondral options, either taking a piece of cartilage and bone from you or from a donor.
When you take it from a donor, we try to size match them, so we're not taking. We want to match the anatomy as much as possible. And the nice thing about that is the cartilage is fully formed, and cartilage can live in somebody else's body. It doesn't have rejection per se. It's not like a heart transplant where you have to take drugs to prevent rejection, but you do still have to have growth or bone ingrowth into that cartilage plug.
And to stick with the landscaping analogies, that's a little bit more like sodding. So yeah, it still needs to kind of heal the roots, quote unquote, the bone needs to heal, but at least it's fully grown cartilage.
And then lastly, we have some new techniques, which we have CartiHeal, which is coral, which we put into cartilage defects, and the body is pretty good at growing cartilage over.
The dog bomb. Yeah, it tries to help your body heal itself.